Hello, ladies and gentlemen. Thank you very much for joining me today in this webinar broadcast from beautiful Ojai, California. I hope this webinar helps you to learn how to understand the causes and natural remedies for pain and inflammation. So to treat pain, you have to understand the cause of pain, what is behind it. I mean, in Ayurveda, pain is called shula, which is a symptom, not a disease. So that means there's a cause behind the symptom. There's other forms of disease or imbalance or toxicity that's behind the creating this inflammation. So we have to understand the cause. We have to understand the pathology, the path, and the way that the pain was developed. And of course, in Ayurveda, it's not so simple as just one particular cause. And we don't want to just be taking analgesic herbs, pain-reducing herbs, or opiates or something to reduce the pain, because this is not addressing the cause. And this is why this type of treatment is not helpful. It doesn't matter whether you take a natural approach or a pharmaceutical approach to pain. Stopping the pain is not necessarily the goal. It's removing the causes that created the pain. If you only think of taking painkillers, whether it's aspirin or white willow bark, which was an older form of pain killer, which is what aspirin was derived from, and it can reduce inflammation and pain for a short period of time, you're not addressing the causes. It's like turning the alarm off in a burning fire, but not putting out the fire. And this is why you have to continue to take painkillers on an ongoing basis, is because we're not removing these causes. And this is why people are on taking pain medicine for a lifetime. And what we do in Ayurveda is remove these causes. And like I said, we have to understand what are these causes, and we're going to cover that. We're going to cover the causes of pain. We're going to cover the different areas of pain in our body, because the treatment depends on where the pain is in the body. And of course, different types of pain, according to Ayurveda, and then different herbal treatments, mostly for pain. And we'll, of course, have to cover some form of dietary guidelines, because there's many foods that can exacerbate pain and many foods that can help reduce pain. Let's go back to our understanding these causes of pain, because to treat pain effectively, you have to remove the cause, unless you want to take the pain medicine for your entire life. And many of my clients who have rheumatoid arthritis, autoimmune conditions, inflammatory bowel conditions, fibromyalgia, inflammation in the joints, the muscles, the tissue, even migraine headaches, often are dependent on taking these pain medicine. But through proper treatment of reducing these causes, eliminating these causes, and which can be the diet, the lifestyle, and of course, past accumulation of toxins and even your own digestion. Once these are identified and eliminated, then within a few months, people can recover from even serious conditions of rheumatoid arthritis, serious autoimmune conditions, because the causes are removed. So I'm sure you're wondering, what are the causes? Well, there's many causes, and we could summarize a lot of these causes under the category of ama, or toxicity. And we don't just think in Ayurveda of toxicity or ama as only environmental toxins like heavy metals, even though these can definitely contribute to inflammation, but also toxins that have created in your own body. So the first type of toxin, or ama, we call amavata, and this is a toxin that accumulates in the system over time due to vata. Vata is cold, light, and dry, and this creates generally poor digestion and constipation. And the constipation over time, we have to define constipation. First of all, constipation is maybe skipping a day for sure, and maybe only going one incomplete bowel movement a day. That still would be constipation. When the bowels aren't completely cleared each day and you don't feel empty, then you could say you have constipation. So this we know is the waste products, or the mala of the body, the waste that needs to go out. And when this doesn't transit fast enough through the large intestine, colon, and exit the body, then we have what's called toxicity, where the toxins that the body was expelling, that was in the fecal matter and the bile for that matter, taken from the liver, accumulated toxins that have been taken from the blood, taken from the system, and then put in the bile, which went into the small intestines, and then goes out with the fecal matter. Well, if this doesn't go out in a timely manner, it can be reabsorbed back in, and this can be all forms of toxins. And these toxins could accumulate just through normal living, through our bad air, bad water, all the chemicals, pesticides in our diet. And this accumulates over 10, 20, 30, 40 years. And then is not eliminated fast. That's why it's accumulated. And then it's reabsorbed back into the system, gets back into the bloodstream, circles around, circulates in the bloodstream. And because maybe the liver's overburdened and isn't able to filter and remove it, kidney problems could also contribute to this type of autotoxicity. And then these toxins in many forms, but we're talking about a particular type now, which is dry and hard, like we could say almost undigested aspects of ourselves that our body is unable to digest. And these toxins then get lodged in our joints in this particular case. And then we have a type of joint pain, arthritic pain. Now, the same toxins could circulate around and get stuck in our muscle tissue, or could accumulate in our even in on our surface of our, particularly surface of our skin, particularly if we're not sweating, because the sweating is an eliminating channel, and those who are dry then have lack of sweat, so you're not eliminating toxins properly through the body over a long period of time. So if you've been chronically dry for a long time, it's like being chronically constipated. You're not eliminating through your skin tissue, and this can accumulate, and you can have inflammation in your skin. We could see like a type of psoriasis, or even in this particular case, in Vata type would be more like eczema, dry, flaky skin problems. And this is basically toxins that have accumulated that haven't been able to exit the body because you've been too dry to sweat it out for so many years. So just like we can inhale smoke and tobacco smoke, and it lodges in our bronchi and our alveoli, and then we have cough, and we have basically toxins in our lungs. And we can clean these toxins out of our lungs with certain ways. You could watch some of my videos on respiratory conditions to understand how to do that. But it's the same concept. Instead of the tar and being stuck in your lungs, or the pollution being stuck in your lungs, it becomes lodged in your joints in this particular case. And we call Amavata. And this is a type of dry, hard, painful joint pain in most cases as a result of poor elimination through the colon over many years. So in treating it, in fact, you have to treat the colon as well. You have to keep, because this is one of the causes. So many people with rheumatoid arthritis, for example, have this type of dry, achy pain that's becoming inflamed and hurts when they move. Then they'll find that as soon as the bowels are moving better, the pain actually is reduced a little bit. So this is one cause, this lack of elimination. Another cause is we call amapitta, and this is due to fermentation of toxins in our body. And acidity, heartburn, burning sensation are generally the signs. And this also is coming from a different form of poor digestion. Instead of poor elimination, it's too much acidity, and with Ayurveda, too much pitta, and we're creating acidity, burning, heartburn, and this is creating toxins. Kind of like an engine when it's burning too hot. Say you mix the carb and the air fuel mixture, and you have too much fuel and not enough air, and it's burning too hot, and then the engine burns so hot that it starts destroying the rings and the exhaust manifold and other parts of the engine. And then when you go to the engine, you can see this black soot in the exhaust pipe. So this is the same type of toxins. When you're burning too hot, when there's too much pitta, or in panchaka pitta in particular, in the body, the strong acidity, strong burning, this strong appetite, and there's often pain and heartburn and GERD and other symptoms like this, you're creating a type of toxin, just like an engine overheating, that ends up getting lodged in parts of the body. Now, these toxins could get lodged anywhere, but this particular type of toxin we're talking about often gets lodged in the muscles. So we have tender muscles, painful muscles, and it's exacerbated by high body heat. So this type of person may have a strong appetite, warm body temperature, by nature, get hot easy, history of acid reflux, but now they have muscle pain. We can give these conditions fancy names like fibromyalgia, rheumatoid arthritis, and degenerative type of arthritis, which would have been the first one. Vata would have been like a degenerative type of arthritis where there's a depletion. This is Vata type of cause behind it. And we could expand on that one a little bit more. And that's also created by Vata, but it's this type of degenerative pain. So this often comes from symptoms are cracking joints, cracking. It hurts when you move. People often get this who are thin, underweight, fasting a lot, low-fat diet, not having any dairy, butter in the diet, and they've depleted themselves. So it's degenerative conditions, and the bones have degenerated, the cartilage is degenerated, and now there's friction between the joints, and this is creating your pain and inflammation. So we're up to 3 different causes here, if you're with me. The third or fourth type we could say is kapha related, and this is due to congestion and blockage. So this is a person with poor circulation, usually heavier weight, a blocked lymphatic system. Maybe they have lumps, fibroids, maybe some types of extra growth or tumors or cysts on the body, poor elimination, sticky, congested type of bowel movements. And this type of clogged, congested person also starts to have a pain. Often it's a more kind of a dull, stiff pain that can be in the lower back and the knees due to the weight of the person. So this person often has heavy weight, so we can see the pain in the knees, the ankles, and there's often swelling involved, pain and swelling. So this is type of kapha type of pain. And of course, environmental toxins have a big factor here as well. I mean, as I mentioned, heavy metals taken into the system, and there's so many types of heavy metals that could affect you. There's cadmium, mercury from tooth fillings, and many forms of heavy metals that we can end up consuming over unconsciously, or we're unaware of it over time through our environment, our food, or water. And these accumulate, and they're very hard for the body and the eliminating channels to eliminate. So they then create, then the immune system then attacks them. So any pathogen in the body that the immune system then trying to attack and attack and attack to get rid of, and it's unable to win this battle, then we have another inflammatory type of condition, type of autoimmune condition, where the toxin is there. And this is the difference between, say, eczema, where there's this dry, flaky, spreading condition throughout the body, but it's not hot and it's not so red. Once it becomes, the immune system starts overreacting and attacking it, or attacking these toxins, and this is what often happens with heavy metals and some environmental toxins that aren't able to get out of our body or be eliminated, because our body just isn't capable of eliminating some of these metals, particularly if we're not sweating or drinking enough water to urinate and not having 2 or 3 bowel movements a day. Then these toxins aren't getting a chance to get out, and then eventually the immune system can react to them, and that would make, if it was on the skin, for example, more of a psoriasis type of condition, where there's more red, there's more heat, there's more burning. And then we have autoimmune conditions. So these are just some of the causes. We could also talk about psychological causes, even social causes, social pressure, job pressure, relationship stress. All of these can affect the nervous system, and we can have nerve pain, headaches, migraine headaches, all due to these type of psychological conditions. And of course, there's causes behind our sensitivity, our vulnerability to these psychological states, which is another subject, and why some people would become anxious and have pain while other people wouldn't in the same situation. So first, we need to identify the causes, and there are other causes besides these. And this is really the real challenge in treating pain, is diagnosing these causes. And as I've said in all of my webinars, you can't blindly treat anything. You have to always diagnose first. Diagnosis is always the first step in treatment, and often avoided. And we just jump ahead, and we want to take turmeric, we want to take ginger, we want to take something for our pain, but we haven't really diagnosed it properly, so we don't know the causes. So in fact, we're just guessing. So this is why we see so much hit and miss with natural remedies, is because people aren't diagnosing, they're guessing. And some people it will work, some people it won't work. Depend on how fortunate you are in your picking of the many types of treatments there are for pain. But once you have the proper diagnosis, then you can choose the proper treatment with confidence, and the results will be much more consistent. And, if you're in a professional practice, then this is very important to be consistent and not make somebody's condition worse. And this is what could happen if you're just guessing and handing out pain-relieving herbs or pain-relieving substances. So next, we want to talk about different areas we could have pain, because that also dictates the type of herbal treatment and type of treatment that we would use. Of course, joint pain being the most common, but also there's muscle pain, as we mentioned, called fibromyalgia, where muscles are tender, sore, inflamed. Nerve pain, like in sciatica. Now, of course, there could be other causes like pinched nerves or problems with the vertebrae. But there could be like migraine headaches. And of course, there's many types of migraine headaches. There's dull headaches that feel like a rock sitting on your head, sharp headaches that are penetrating, and then headaches that seem to come and go, and the pain's in different places. So even when it comes to migraine headaches, it has to be diagnosed. It has to be understand what the energetics behind it are that creating it, and it needs to be addressed at that level. And then you can have pain in your tissue, in your skin. Your skin can be burning and painful. You could have like endometriosis. You could have pain in your reproductive system. We could have tooth pain. We could have an abscess. We could have pain in our stomach, and create ulcers. We can have pain in our colon. Inflammatory colon conditions, IBS and colitis, are all pain and inflammation in the colon. So all pain can't be treated the same way, because not only are there different causes, it's in different parts of the body. And different herbs, different treatments are all different for different parts of the body. Certain herbs have an affinity for treating the nerves. Certain herbs have an affinity for treating pain in the muscles. Certain herbs and herbal formulas have affinity for treating, inflammation in the skin. Certain herbs and formulas have certain affinity for treating inflammation in the intestinal tract. So there's no one answer to how to treat your pain, and there's no one herb that's going to do it. I know that's sad, reading that turmeric is a cure-all, but it's not. We're not using turmeric in any of these treatments that I mentioned here, because it's too mild. It's not that effective of an anti-inflammatory. There's just better choices. Not that it doesn't have anti-inflammatory qualities, but you'd have to take such large amounts of it to be effective that it's not that useful in treating chronic inflammatory conditions. And it's, as we know, turmeric is related to ginger. It can be very heating. And some of the causes of some pain, like migraine headaches that are sharp, fibromyalgia, where the muscles are hot and warm, this having large amounts of turmeric could actually make it worse. So just hoping that we can take a lot of turmeric is not effective, because I think all my clients that have come to me with these various types of inflammatory conditions, including autoimmune conditions, have all tried turmeric to some degree, and with some success and to some degree for some of these people, but for others it was completely ineffective, which makes people lose confidence in herbal treatments. But it's nothing wrong with herbal treatments when you don't know what the herbal treatments are and you haven't diagnosed what herbs are being used. And in Ayurveda is a very ancient system of herbology, and they've already have formulas for muscle pain, joint pain, nerve pain, and for different types. So there's three main types of pain according to Ayurveda: Vata, Pitta, and Kapha pain. And Vata pain is usually moving, changing, and cold makes it worse. And it's usually a dry pain. When you move, it makes it worse. When the weather's cold, it makes it worse. Cold weather, exasperates it. A warm bath and a hot bath and a salt bath makes it better. So that's the type of Vata pain. Then there's Pitta pain, which is heating and warming. And when you touch it, it feels hot and clearly inflamed. And if you take a hot bath, it feels worse. In fact, it could feel better by taking a cold shower, or jumping in even some cold water and going swimming, it will feel better. For these type of people with this inflammatory hot Pitta pain, they like to swim. It's cool, and then the pain comes down. Well, a person with a Vata pain would feel worse in a cold swimming pool and will feel better in a hot tub with some salt, for example. So big difference there, and that can be just based on the individual. And then there's Kapha, and Pitta pain is sharp. Like sharp, intense, hot, burning. Those are its qualities. If it's in the head or any part of the body, these are the qualities of this type of Pitta pain. And then there's Kapha pain, which is more dull and heavy and congested. Things are stiff, kind of like stiff pain. It kind of hurts to move, and you don't move very well. And it can feel like a dull headache. It doesn't come quickly, but it doesn't go quickly. It's not that intense, but it doesn't go away easily either. So that's a type of Kapha pain. So let's summarize here. We have to first understand the cause. Why do you have pain? That's really the main question. When people call me on the phone, they say, what can I take for my pain? You treated my sister, my uncle, my friend, and all of her joint pain is gone. Her fibromyalgia is gone. As you can see, I have hundreds of testimonials with people saying that their pain, even fibromyalgia, was gone in a matter of days. Their rheumatoid arthritis condition was gone in a matter of weeks. Their degenerative arthritis was gone in, say, a month. And, their autoimmune pain and inflammation was much better in a matter of days, and maybe gone in a matter of months by taking these herbs. So how could this be done? That's because there's already formulas existing for all of these conditions in Ayurveda. I'm not making them up. I'm not inventing anything. I'm not an inventor. I'm a follower of Ayurveda. So I'm following traditional herbal formulas and traditional herbal treatments. And that's why the success rate is high, because I'm not trying to create anything, research anything, or discover anything. I'm following. So this is like King Solomon said, there's nothing new under the sun. Everything is here. I mean, I often see people looking in vain online for, cures to certain conditions. And if you don't know the cause behind it, the type of pain and what you're doing, then this can really be fruitless. But in fact, the cure is out there. It is there. It's just, if you don't know what you're looking for and you don't know the questions to ask, then you won't find the right answer. But in this case, in Ayurveda, we're able to diagnose it and put it in certain categories, whether it's Vata, Pitta, Kapha pain, whether it's in the muscles, and what are the causes. These are the three things we have to know. What are the causes behind it? What part of the body this is in? Maybe it's the joints and the muscles. Maybe it's in the joints, muscles, and nerves. And the energetics behind it, or the doshic imbalance, which are creating. And there's always Vatas behind all pain. So technically, we could say that Vata is a cause of all pain, but there's Vata and Pitta pain, and then there's Kapha blocking Vata, and this creates pain. So these are the different combinations of the pain. So once you've got it classified, then you can look up in traditional Ayurvedic textbooks and find the formula that will match it, and then your success rate will be very high. So that's what we're going to cover today, is some of these formulas and some of these herbs. No, we're not going to cover turmeric because it's just not strong enough. But let's talk about some analgesic herbs. These are not necessarily dealing with all the causes, but what did aspirin come from? Aspirin came from white willow bark. So white willow bark is a natural form of aspirin, and so I have a tea here. Again, this is not treating the causes, but this can help a person get off of aspirin or off of painkillers. And it's called, joint and pain tea, and the main ingredients is white willow bark. It's also got some other anti-inflammatories in there, like St. John's wort and skullcap. And I use devil's claw too, which is another very strong analgesic herb. So devil's claw and white willow bark are analgesics. It's not going to remove the causes, but it will help to reduce the pain, like a kind of taking an aspirin. And that's sometimes necessary. What we use mostly, the main thing for pain is, and here I have some fresh right here. This is it right here. Anybody can guess what that is. That is boswellia, frankincense. And this is frankincense sap from the trees of Oman. And there's different grades and different qualities of boswellia, we call it. And that one is there from Oman. And this is what I'm using mostly here. We call shilaki, and in Ayurveda, which is the Sanskrit word for boswellia. And it's in a powder form, and you can see it's very white, very high quality. And this is probably the main anti-inflammatory we're using in this particular formula right here, anti-inflammatory formula. The first ingredient is the boswellia. And then there's a little bit of turmeric, kind of more of a filler. And there's a little amlaki, which is, we could say, a kind of a antioxidant, and then a little ginger to help you digest it. But the main ingredient is boswellia, and this is working very well. And some people, we have them take it with milk. Some people, they take it with aloe vera, and some people take it with hot water and honey, depend on the individual. Aloe vera is another very good form of good anti-inflammatory that can help. And other herbs we use that are called rasna. Rasna is another analgesic herb that's used for killing pain. And then I'm going to show you 3 or 4 formulas in Ayurveda that are using guggulu. Guggulu is another good analgesic pain-reducing herb. And there's quite a few formulas in Ayurveda that are made for some of these conditions that we described earlier. For that dry, achy type of vata pain, where it's dry, cracking, and is cold, not hot, and feels good with hot weather, then traditionally, if you look in the text, you will be recommended to take Yogaraj guggulu. It's a type of guggulu with other herbs, including rasna, which I just showed you. Doesn't have the boswellia. That's often given separately. And I sell it here in this form here called Vata Pain and Detox for Vata. And that's basically Yogaraj guggulu with a little nirgundi. Nirgundi is another analgesic pain-reducing herb. And then tagar. Tagar we use in sleeping. It's a sedative, but it also helps in particularly in nerve pain and other forms of pain. And then we have pitta or kapha pain and detox right here. And it's using another formula called Simhananda guggulu. And this is for more stiffness in the joints. Then we have another one called stiff, heavy, kind of like, the kapha type of pain, where you have stiff, achy type of joints. And then I have a pitta pain and detox. And this is for the one where there's heat, inflammation, because the other two are both using warming herbs, heating herbs to reduce the pain. But this one, pitta pain and detox, is coming from the formula Kaishor guggulu. And Kaishor guggulu is coming from the main herb Guduchi, and with other herbs like rasna and nirgundi that reduce pain and also cool the body down. Now, what's so important and unique about these Gugulu formulas, which I just mentioned, all three could be used for what we would generally call arthritic pain. But since in Ayurveda there's three and more than three different classifications, one was for Vata, one was for Pitta, one was for Kapha that we covered earlier. So they're very specific for that individual. So if I give you a pain formula, you may not be suitable for your spouse to take the same pain formula. In fact, some of the pain formula given to one person could make pain worse in another person. So you need experience and not just diagnosing, but in treating and becoming familiar with the doses and be able to always look at the whole person holistically, not just, see only pain. But what I was going to say is what's unique about these is that they're removing the causes. Remember, we talked about the cause being toxins lodged in the joints or the muscles or in the tissue itself, and sometimes even the immune system coming and then attacking it and creating more inflammation. Well, this Gugulu literally circulates through the system into through the blood system after taking it, and it itself then gets into the muscles and the joints, and it removes these toxins. That's why these formulas are called pain and detox formulas, because they're analgesic in the sense that they're lowering the pain with the Nirgundi and Rasna, and also Gugulu has analgesic qualities. But more important is that they're detoxing these joints or muscles or nerves and actually cleaning them out and removing these toxins. So that's why people can take these herbs for 2, 3, 4 months and all the pain is gone, because the job is done. And most people, I start them off with one 4-ounce jar, and they come back, I ask them how the pain is, and they say, oh, it's 50% better. I mean, I still feel it, still there, but it's for sure about 50% better. So then I give them one more jar, and they come back second time, and the pain could be gone. Sometimes it takes 3 jars, 4 jars, 5 jars. And then I combine that with the anti-inflammatory. So usually these two together. So for like fibromyalgia, where there's clear inflammation, I do Pitta pain and detox, plus the anti-inflammatory formula, which we talked about with Boswellia. When we have a Vata type of pain, where you have like degenerative bones, well, we have to maybe support the bones too. But that cracking, dry type of arthritis, then I give a Vata pain and detox, cleaning out the toxins that are accumulated in the joints, and the anti-inflammatory. And of course, the colon herb. In all of these treatments, there has to be secondary herbs to have a lasting effect, because the secondary herbs are dealing with the causes. For example, in Vata type of pain, we know the cause came from this 20, 30, 40 years of constipation. So there has to be herbs for the colon. And for this Pitta type of pain, where there's this kind of burning and acidity, and then this type of toxin that accumulates from this type of high Pitta and acidity, we have to give, anti-acidity cooling herbs to bring down the acidity, and be taken after every meal as well, and change the diet, of course, to avoid this cause. And for Kapha, often it's a matter of losing the weight and getting the system going and circulation going. And this would entitle exercise, and losing weight would also have to be included in these treatments. And of course, there's herbs to help with weight loss. There's herbs to help with circulation. There's herbs to help with breaking up lymphatic congestion and getting it moving. So you would want to treat these causes and treat the pain and treat the toxins accumulating in the particular tissue of the body. Here's another one, and this one is for even more effective and using different herbs. I don't know if anybody's heard of Kalonji. Kalonji is black cumin seed. The Prophet Muhammad, peace be upon him, said that it's a cure for all diseases. And I've seen it on Facebook now, and it's very popular. It's used for anti-cancer treatments as well. And that's one of the ingredients in here, along with ajwan and fenugreek and chandasor, which is another analgesic digestive herb. And this formula is very hot, very heating. So for that person who's thin, cold, dry, and particularly cold, this can be very effective, even more effective than the other formula, particularly when the pain is quite high. And sometimes it would be combined also with the anti-inflammatory. So, I have a few choices here of different formulas, pre-made formulas. That traditionally, that formula is called Hakamchurna. And it's that I could choose from for almost every case. And then in many cases, I formulate the formula. For example, some people, they could be a little hot, a little cold, or they're not right in between. So I may combine these two formulas, Kaishar Gugulu, which is for this hot inflammatory type of pitta pain, combine it with Yogaraj Gugulu, which is for more Vata type of pain. So sometimes I'm even combining two of them together to make it, and sometimes I'm changing the formula to suit the individual. So there's nobody's really getting the exact same set of herbs for their pain, because your spouse or your family members could have different causes of your pain, even though you're all having type of joint pain. The causes can be different, the treatment will be different, and the individual is different. And since Pitta is often behind a lot of pain, particularly when it's burning and hot, we have a formula called Pitta Balance. And this is often combined with one of these other formulas when there's a lot of heat, acidity, and fever. And the body is very hot and is feverish, and there's a lot, even acidity. So we combine that, and there's analgesic, pain-reducing, antipyroric, heat-reducing type of herbs in there. And this will, guduchi, and even coral powder made from coral is very cooling, and even sandalwood. It's very cooling. They call sandalwood chandra, which means cooling. So it's a cooling, putting out the fire, putting out the heat, and that sometimes needs to be combined with some of these other formulas. And then, of course, depending on where those formulas, those Gugulu formulas I just mentioned there, they're mostly good for the muscle and the joint pain. But for, say, endometriosis and inflammatory periods, painful periods, then, we have certain formulas that are just made for inflammation and pain in the reproductive system. For women, it's a whole nother subject. Let's talk about a few spices that could be used to help with pain. I have this one here called Pitta seasoning, and it's quite cooling. It's not hot, using mostly coriander, fennel, cumin, mint, turmeric, dill, cardamom, and a little salt and asafetida. And particularly if the person is hot and acidic, this can bring down the acidity, improve the digestion, not create more ama or toxins, and help with inflammation. Just like, so this is the best way to use your turmeric, is just use it in the cooking. Don't need to take capsules of it. This is absurd. Don't need to take tablespoons of it. There's better herbs to help you with it and your inflammation and pain, but cook with it. You could cook with it in small amounts with each meal, and your soups, your stews, your khichiris, your dals, your lentils. You could cook with it. You can even sprinkle it on your food, and this will be the best way to integrate turmeric into your diet. Probably not a cure-all for advanced stages of inflammatory joint pain, muscle pain, nerve pain, but it will help to some degree, and it's very preventive. Mild inflammation, it can be enough. Here's another formula. This is for release abdominal pain and inflammation using Western herbs and a meadowsweet, a nice anti-inflammatory, and a cat's claw. Cat's claw is a nice internal anti-inflammatory, and we use it for cramping, muscle pain. And then, of course, there's inflammation in the colon. In fact, in Ayurveda, a lot of times we have special herbs just for inflammation in the colon, and special formulas like Dadimastika that are made just for inflammation in the colon. But often we use enema. We put anti-inflammatory herbs in an enema bag, mix them with water, strain it out, and put it straight in the colon. And this can relieve a person very quickly, in a matter of days, of serious inflammatory colon conditions, because you're taking the herbs right in the colon, addressing it right where the inflammation is. And for muscle pain, joint pain, particularly nerve pain, we use oils on the body. We have an anti-inflammatory oil here, which is available on the open market, and it's using dashamula, which is dashamula means 10 roots, and dashamula is very good for nerve pain. It's made from 10 roots, and it's providing the minerals, and it's very anti-inflammatory. And there's other herbs in here, including camphor as well, and even ashwagandha, which you must be familiar with, I hope, and neem, and even a little valerian, which is a type of sedative. And there's even a little turmeric in here. It's quite a few: ginger, clove, guduchi, licorice, and even mineral salts and tulsi. So all of these herbs are in the oil. They're not just put in the oil, but there's a big decoction made in water first, and then the oil's added, and then the water's boiled off, and then the essence of these herbs then goes into the oil. It's the proper way to make these. So it is a process to make these talam, or herbal oils, but they can help quite a bit. And I have different ones. I have ones for like nerve pain, ones for joint pain, ones that are cooling, ones that are heating. Again, different ones for different conditions, different types of pain, but they work very good. I have one kind of one, it's like a vata oil. You can use it for, it's often called vata massage oil, and it's got nervines in it, which help the nervous system. Sometimes some sedatives like valerian or tagar. And this oil can be put on the body where the nerve pain is, where the sciatica is. And this can help quite quickly to nourish these nerves. And you can say some of these herbs are like food for the nerves. Often the nerves are depleted, just like degenerative bone conditions. We can say that bones are depleted, and they need to be fed certain nutrients to recover. So not only would you want to take care of the inflammation, but then you'd want to nurture these bones, nurture the cartilage growing back. And often what we do for that dry, cracking type of bones, we give more ghee, more butter, more fat. And within 2-3 weeks, a patient can come back and they don't have the cracking joints. And even the pain is greatly reduced just by adding butter to the diet. That's right. So when you have the proper diagnosis, and you know that the diagnosis for this particular case is this lack of cartilage, lack of body fat, low fat diet, depletion, too much fasting, skipping meals, over exercising, all of these, and then you have this dry, painful type of pain, you could tell the person just rest, eat a lot of fat, have a lot of butter, and you may see, without any herbs at all, markable improvement. And that's because you have a clear diagnosis, you know the clear cause, you're able to treat it even with butter. But even if you had a different type of pain, kapha type of pain, which was due to heavy weight on the knees and congestion and blockage, then obviously giving a person butter is going to make it worse instead of better. So again, diagnosis is everything in proper treatment. And we can't really talk about reducing pain without talking about the diet, because despite mainstream view that diet has nothing to do with our health, it has everything to do with our health. And many people who have changed their diet realize that their pain was reduced, and many of their other health problems were reduced just by improving their diet. When we say improving your diet, particularly for inflammatory conditions and autoimmune conditions, we mean eating organic foods and getting these toxins out of our body that's making our immune system to become overreactive. And creating more toxicity, which is accumulating in our body and creating this inflammation. So being on a organic diet and avoiding, pesticides and chemicals, because if it doesn't say organic on it, it might as well just imagine it has a label on it that says full of pesticides and chemicals that are eventually going to lodge in your system and create inflammation and pain later in life. That's what we really should be sticking on all these foods instead of what do we say, conventionally grown. I think it should just say full of toxins and chemicals will eventually create pain, inflammation, and other health problems later in your life. I think if we stuck that on all these foods, then organic foods would become more popular, and we would have a lot less health problems, and particularly inflammation and pain. But what are some of the main causes besides these chemicals and pain? Sugar, white sugar. I didn't mean fruit. Cooling fruit, melons, actually sweet taste can reduce a lot of pain. Fruit can be very helpful in inflammatory conditions, particularly pitta type of inflammatory conditions. I've done people with who had inflammatory skin conditions like psoriasis, and we did a sweet grape fast. Means not the green grapes, but the red grapes, and they did it for 4 or 5 days, and it cleared up their skin, detoxed them, and the sweetness, the cooling of these grapes brought down their inflammation and pain. Well, only having grapes cleaned them out and detoxified them. In 5 or 6 days, we could see the psoriasis greatly improve just by eating grapes. So sweet fruits can be very helpful. Not all cases, but definitely can be used. So we wouldn't call them sugar. Sugar is, we're talking about white sugar, not organic cane sugar. Organic cane sugar can actually be very helpful, particularly if you have like gingivitis, inflammation in the gums. Then sugar cane juice can actually feel quite comforting in your mouth if it's inflamed. Of course, if you have an abscess or tooth pain, it's a different subject. But what I'm talking about is white sugar, candy bars, things like this, cookies, baked goods with sugar. This should all be avoided. Next, coffee. Even black tea, very inflammatory. Chocolate, I know it's been heavily promoted. I know it has magnesium in it, and it can be good for certain people, but it is inflammatory and increases pitta. So particularly when you have it with sugar. So chocolate's inflammatory. And most important, as many people know who have had inflammatory conditions and done a little research, is that the nightshades in our diet, which are tomatoes, particularly cooked tomatoes, particularly tomato sauce from a can, is extremely inflammatory. And this, the whole nightshade family would include eggplant, paprika, bell peppers, white potato, but the main culprit usually is tomatoes and tomato sauce. And for many people who I've met, say on Skype, and which means that I could change their diet by talking to them on Skype, but it would require 3 or 4 more days for me to mail them the herbs. By the time the herbs got there, they said, my pain is already like 30, 40% better. And I go, what did you do? I said, I just got rid of the tomatoes and followed the other dietary guidelines, because it would be different for each individual. But anybody with inflammation pain, whether it's muscle, nerve, or joint, can safely remove these nightshades, which at one time in history were considered poisonous. And you notice that animals don't eat them as much as they would eat other vegetables out of your garden because of their inflammatory quality. So it's always good to eliminate these. It doesn't mean everybody has to eliminate them. If you don't have pain and inflammation, they're not harmful, particularly for the kapha type prakriti or body type. Castor oil is another natural kind of pain reliever for vata type, and also get the bowels moving. So for that first type. So I just didn't cover that. I think we covered a lot there. But in fact, the bottom line is each person needs to be individually diagnosed and individually treated, and there's no quick cures, because if there was a quick one-off cure, then somebody would have typed it up already by now, and we would all be reading it, and there would be no pain. But since there's many hundreds of different causes of pain, and every individual is different, their lifestyle, the amount of stress they have in their life, their diet, their habits, the amount of exercise they do, all are factors. In fact, many people with muscle pain are over-exercising. Many people who have cramping and muscle pain are depleted. A lot of times we're depleting ourselves in creating pain. If you muscles, for example, don't have enough protein, then they can start cramping if they don't have calcium, magnesium. This is all types of forms of depletion. So you could take some magnesium and your cramping may go away, but the underlying cause is you're depleted. And this often comes because people are obsessed with losing weight, staying thin, skipping meals, fasting, and sometimes over-exercising. So over-exercising, over-fasting can create depletion in the body and lead also to pain. So once again, we'll review, identify the causes of pain, identify the areas in the body that are pain, and then break the pain down into different types of pain according to Ayurveda, Vata, Pitta, or Kapha, and then you treat it accordingly with this information. And don't forget to treat the other causes, which can be constipation, acidity, overexercise, depletion, whatever these causes are. They have to be treated separately. So that's why everybody has a separate treatment. But myself and all other Ayurvedic practitioners that I've met, both in the United States, but particularly in India, where they have a greater selection of herbs available, have been very successful in inflammatory conditions. Autoimmune conditions are more complex because you got to treat the immune system, and you got to provide immune modulators too, to modulate the immune system. And there's many things that can stimulate the immune system too much, including mushrooms. So, it becomes a whole nother subject. Maybe I'll do a webinar on autoimmune conditions. But for your average inflammatory joint, muscle, nerve pain, these treatments in Ayurveda have been very successful. And I have hundreds of testimonials of people giving the details of how quickly they recovered and how surprised they were that the treatments were so effective. And in a matter of months, they recovered. So I hope that gives you hope to overcome your pain. And I hope that you find relief from your pain and don't only try to block it or turn off the alarm or take pain relieving or analgesic herbs to block it out, but accept it. See this pain, in Ayurveda we call shula, pain, as it's not so much a disease, but a symptom, and to get to the cause behind the symptom, and see the pain as a message, as a warning sign. So I always tell people that pain really is your friend. It's warning you. That's just like your alarm system going off in your house. It's your friend. It's warning you. The alarm is going off. There's danger. If you don't act at this time, it's only going to get worse. So in these early stages of pain, that's when you want to treat it right then, quickly. Once there's inflammation, there's usually some destruction taking place into the joints, the muscles, the nerves, somewhere in the body, and eventually you can have damage, and it can be untreatable at a certain point if it progresses. So the best is to always treat these pain in the early stage, just like a fire. It's easy to put out a small little fire, hard to put out a big fire. And if it burns too long, there's just going to be too much damage, and it's going to be hard to recover. Or even if you stop the pain, the damage to the tissue or the joints would still be there. So I hope you address your pain quickly. Don't put it off. And I hope this inspired you and helped you to overcome the pain. And don't see it as such a negative, but see it as something that helped you to warned you to address it as soon as possible. Thank you very much. And I wish you the best health and happiness. Greetings from beautiful Southern California. I sincerely hope you learned from this video and benefited from all the information. This knowledge is not my knowledge, nor is this information new, but part of the ancient healthcare system called Ayurveda, the science of life. I hope my videos explaining the Ayurvedic approach in a simple and clear manner helped you to overcome your health issues. However, if you have a complex or serious health condition, I highly recommend that you contact me personally so I can meet with you here in my clinic in Ojai, California, or in an online conference call, so I can properly diagnose your condition and provide you with an individualized diet and custom herbal formulas. Then I will follow up and continue to support you until you have recovered. Please subscribe to my YouTube channel below and visit my website for more information, appointment fees, upcoming events, and my schedule, where you can book an appointment directly online. Thank you once again, and I wish you the best of health and happiness.